Good evening, everyone. My name is Angela DeRolf, and I'm your Perry County Health Commissioner working at the Perry County Health Department, and this is our third Facebook video message to you. So in starting out, I want to give you some facts. First, I want to be very clear that at this point in time, Perry County has 0 confirmed COVID-19 cases. However, I do want to share some data with you that as of today at 2:00 p.m., Ohio now has 88 confirmed cases of COVID-19. The age ranges from 2 to 91 years of age, 33 females and 55 males, with 26 hospitalizations and thankfully 0 deaths. There have been confirmed COVID-19 cases in the following counties: Ashland, Belmont, Butler, Coshocton, Cuyahoga, Darke, Delaware, Franklin, Geauga, Huron, Lake, Lorain, Lucas, Mahoney, Medina, Stark, Summit, Trumbull, and Tuscarawas. But I want to be clear, at this point in time, there are 0 confirmed cases in Perry County. So I wanted to put this Facebook message together, or video together for you to talk a little bit about what efforts we are taking to keep you guys safe and healthy here in Perry County. So as this is a public health emergency, the Perry County Health Department is the lead in the response. However, we want to work closely with our agency partners, key stakeholders, and you in the community to keep you safe where you live, work, and play. So in talking about some of the strategies that we use, I want to use Director Actons, who is the director of the Ohio Department of Health. Her example she's been using was Swiss cheese. So you can think about this: when no strategies are taken, a virus spreads quickly and can be catastrophic. But if you imagine adding a piece of Swiss cheese for each strategy, a single piece of cheese has holes and can allow the virus to spread. But the more strategies you take, this compounds the cheese and makes it a bigger sack, which makes it harder for the virus to go through. So I want to share with you today the strategies we are taking in Perry County to keep you safe. So very early on, before all this even started, the Perry County Health Department has emergency response plans that we have in place, and we continually exercise them. In fact, many of you probably exercise with us. It's one of the biggest exercises we do is our annual drive-through flu clinic. Not only is that a real world event for us, that's a way for us to practice bringing in resources, partners, and exercising our plans to make sure we have the capabilities needed during an emergency. So for that, I'm going to give us 1 slice of cheese. Once this virus started, we started monitoring the situation in China, monitoring the early decisions made in the United States, monitoring the early cases in the United States, and again, reviewing our preparedness plans and discussing potential scenarios with other health departments across Ohio to identify how would we respond. Again, another piece of cheese. So once the Ohio Department of Health started organizing conference calls with the local health departments, we had a core group of staff that would sit in on those conference calls to learn more about COVID-19 and what response Ohio was going to take. Ohio has been very strategic in ensuring that the local health departments are speaking with one voice as we move forward to fight COVID-19. So after each call, the Ohio Department of Health would provide us with resource documents or other materials that we would share with partners. We sent things out to our healthcare providers, our school nurses, nursing homes, EMS, and funeral directors. We sent information out that was applicable to them. So again, another piece of cheese. In addition to this, we started providing email or verbal updates to some of our partners, including our emergency management agency, some of our local law enforcement, the county commissioners, and school superintendents. Again, this was all before schools had closed. Response with our healthcare providers. I feel we have had a great and strong response with our local healthcare providers. We have worked closely with our healthcare providers and the Ohio Department of Health to monitor for infectious disease, identify suspected cases early, ensure that patients receive appropriate medical care, and help prevent spread of infection. So we do this, and again, I want to be clear that we have not had any cases any positive COVID-19 cases in Perry County, but there's been a lot of rumors out there and situations that we have had to follow up on. We have also had numerous calls with our healthcare providers throughout the county as we walk them through the testing algorithm and the protocols for COVID-19. We have also had the opportunity to exercise using the testing algorithm and the protocols with many of our healthcare providers in the county, which has been a great benefit not only to them, but to us as we exercise our response and make sure we have a strong response in place for when we have our first case. Another piece of cheese. Again, the response with the healthcare providers, we have worked with Genesis Healthcare Center to deploy the Zumbro tent to the facility in Somerset to assist with their needs. So I'll give another piece of cheese for that. We have deployed the Blue Med tent, the same tent that we used during the Perry County Fairgrounds as our fair booth. That tent has been sent to Genesis Healthcare as they are working to set up an alternate site in Zanesville to do the drive-through testing. And we'll have more information on that when we get more information. But I want to be very clear. Health departments across the state of Ohio, including the Perry County Health Department, do not have the options to test, or do not have the capability to test. So what that means is that as you watch who can test, you'll start seeing across the state that some of the larger hospital systems have been setting up the drive-through capability, and that's exactly what Genesis is going to be using our Blue Med tent for. And so this is a way they're going to have it off-site from their hospital to help protect folks that are in their hospital and their healthcare workers. There's also going to be certain restrictions on who can use the drive-through testing capabilities, and we'll have more information to share with you at a later date on that. Response with our elected officials. Every year in March, the Perry County Health Department holds the District Advisory Council meeting. Every township trustee, mayor, and county commissioner is invited to that meeting. We have held that meeting, and during that meeting, we shared an update on our COVID-19 response and asked for feedback for ways to improve our response. So the local officials were brought up to date with what we were doing at that point in time. We also, however, want to continue to reach out to our local officials to make sure they are aware of our response and can help us. So we are in the process right now of working to set up a call with the mayors and township trustees so we can further communicate our efforts. However, we need help in reaching some of these folks, so we need email addresses of these individuals. That way we can email out call-in information. And we are currently working with the Perry County Emergency Management Agency to coordinate this. So we'll give another piece of cheese. Response with county agency heads. We have started daily briefing calls with all Perry County agency heads. So during these briefing calls, we are providing education information. We are answering their questions. But we are working as a team to identify what needs the county is seeing, and then working together as a team to allocate resources and provide resources when needed. Some of the things that I can get up on Facebook to help provide to you guys is guidance on preparing workplaces for COVID-19. So I'll work on getting that up to you for the workplaces. We have provided signage. We're in the process of developing a county website. That way you can look to see on that website some useful information and also identify what county agencies are open and what services are being provided at that point in time. We are also making a list of all the carry-out food options throughout the county, so that will be on the website. So that's to come. So I'll give another piece of cheese for that effort. Here's an example of the sign that I mentioned that we developed, and we can get this to you. If your business wants this sign, we can put this outside of your door. So basically what this says is if you have a fever, new cough, or shortness of breath, stop, please do not enter, and it gives a phone number that you could call them. So this is our way of trying to protect you from coming into contact with one another. So if your business would like one of these signs, we would be happy to provide that. Today we also started deploying some additional signs out in the community. The first one is Stay COVID-19 Informed. So it has places for you to get credible information, whether it's the COVID-19 hotline, the Ohio Department of Health's COVID-19 website, the Perry County Health Department Facebook page, And we're also promoting signing up for Everbridge, which is the county's alerting system. We also have a sign that talks about how to protect yourself from COVID-19 and reduce spread, and what symptoms to look for. These were deployed today out into our community, so you will start seeing those at grocery stores, banks, and other businesses that are still open. If you are a community member with a business and would like a sign, contact the Perry County Health Department and we will make sure you get one. With those signs, we were also working with the schools. The schools will have a sign at their location when kids are coming to pick up the food, or we're printing smaller copies that they can be sent home with families as well. Some more of the community outreach. Today we started working with our health education division. We have 4 health educators that are working with their community partners that they work with on their grants. And they're working to identify what are some of the community concerns and needs. And then they will be working to develop and obtain educational information that we can get out into the community. We are also working, and we're going to make a call to Holmes County because we have identified a hard-to-reach population in our Amish population. So reaching out to another county to get best practices and learn from them so that we can reach out and help spread the message. And then we're also working on enforcement and education of the governor's orders and the director of the Ohio Department of Health's orders to make sure we're keeping everybody safe. So we'll give another piece of cheese. Again, community outreach, resource needs. We know our first responders and healthcare providers in Perry County need personal protective equipment. We know this is a need. And last night we received orders from the director of the Ohio Department of Health that all non-essential or elective surgeries or procedures that utilize PPE should not be conducted. So what we have been doing, and we're trying to think outside of the box, is reaching out to local dentists, veterinarians, and other businesses that might be using the N95 masks and seeing if they could be provided, donated to our effort to keep our first responders safe as we respond to any COVID-19 cases or concerns. We're also looking at the ability for the Perry County Health Department to potentially purchase some N95 masks off of our community partners. So if you are a business in our community that has N95 masks that maybe you're not using, please contact the Perry County Health Department as we are working hard to think outside of the box to keep our first responders safe. We know that nationwide there is a shortage of the personal protective equipment. We also know that yesterday Ohio received its allocation from the national stockpile. However, those resources aren't going to trickle down to Perry County. They are going to be held back for the hospital systems. So it's important that we come together as a community and try to identify these resources and get it to our first responders. Regional outreach. I have been working very closely with other health departments in the region to try to identify some best practices and even collaborate and look for new ways to strengthen our response. So stay tuned for some of those initiatives that we will be implementing. What are some of our next steps? Well, we know communication can be a real issue here in Perry County, and so we are doing our best to share our response efforts and collaborate with our community partners. However, some of our next steps is we will be setting up regular calls with law enforcement, fire and EMS, all throughout the county. That way, we are all sharing the same message in one voice. And we will be working with the EMA agency, so the Emergency Management Agency of Perry County, to coordinate these calls with those folks. As I already mentioned, we're also in the process of working with the EMA to try to set up regular calls with township trustees and mayors. They really need to help us be the ears in the community of what resources and educational materials are needed. Again, how can you protect yourself? First of all, you need to abide by the governor's orders and the director of health's orders to keep yourself safe. We also encourage you to visit our Facebook page. We will continue to share credible and up-to-date information. Visit coronavirus.ohio.gov. They have ODH staff members who are constantly adding information to this website. There's checklists, there's guidance documents, there's up-to-date information on the COVID-19 response. So please check out this website. Again, the ODH hotline that they have set up for COVID-19, that is staffed 9 a.m. to 8 p.m. 7 days a week, and it's staffed by licensed nurses and infectious disease experts. So they are trained daily with an updated script and have the most up-to-date information. Use this resource if you have general COVID-19 questions. So what can you do to protect yourself? Stay at home when you are sick. Avoid coming into contact with people who are sick. Get adequate sleep and eat well-balanced meals. Take care of your mental health needs. Make sure you guys are washing your hands properly and often. If you don't have access to hot soapy water, you can use sanitizer that's greater than 60% alcohol. Make sure if you cough or sneeze, you cover your cough or sneeze with a tissue, throw it away, and wash your hands again. Avoid touching your face, eyes, nose, mouth. I know that can be difficult, but that will be so helpful. Clean and disinfect high-touch surfaces often. Your doorknobs, your cell phones, your TV remotes. Just think of those type of things in other places and clean those. If you are feeling sick, I can't stress this enough, call your healthcare provider before showing up. They will provide you with the appropriate guidance. And then lastly, practice good hygiene habits. So in closing, educate yourself with credible information. There's a lot of rumors flying around out there. We need to make sure you have the best information available. Be kind, mindful of the fear and anxiety that COVID-19 is causing. We know that the world that we used to know is changing. Our everyday lives has been changed by this COVID-19. So this is the time to think of yourself and think how you can take care of your mental health needs, but also think of others. Pick up the phone, call your neighbors, see how they're doing, check up on friends. Make sure people aren't getting depressed or scared or having anxiety. We need to work together. And lastly, we need your help to strengthen our response. As you can see with all the layers of cheese, we have a pretty good response here in Perry County, but we are always looking for ways to improve. And we want not only constructive suggestions, but if you have solutions to help us improve our response, we want to hear them. I know Director Acton from the Ohio Department of Health has said many a times that during or before a pandemic hits, but we can see it coming, as public health officials, we start trying to educate the public and we start to have these conversations that it's coming. And people look at us like we're Chicken Little, like we're saying the sky is falling and we're creating, just creating panic for folks. But then once the pandemic hits, people start to say we didn't do enough early enough. This is my plea to you to join us in our efforts as we work together to keep you safe where you live, work, and play. Thank you.